Knee pain got you down? Let's talk about Baker's cysts. Hey there everyone, Dr. Doe here, back with another important topic for arthritis and you. Today we're diving deep into the world of Baker's cysts, those pesky fluid-filled sacs that can pop up behind your knee and cause quite a bit of discomfort. If you've ever experienced a dull ache or a strange tightness behind your knee, you'll want to stick around. We're going to break down everything you need to know about Baker's cysts, from what causes them to how you can find relief. What exactly is a Baker's cyst? Anyway, imagine a tiny balloon filled with fluid tucked away behind your knee joint. That's essentially what a Baker's cyst is. It's a benign, meaning non-cancerous swelling that develops in the popliteal space, the area at the back of your knee. While it might sound a little scary, a Baker's cyst is often painless and goes unnoticed. However, when it swells, it can cause stiffness, discomfort, and even limit your range of motion. The usual suspects. What causes these pesky cysts? Let's dive into the common reasons behind these annoying and sometimes painful cysts. Now, you might be wondering, why me? Why do I have this fluid-filled balloon behind my knee? It's a question many people ask when they first notice the swelling. Well, Baker's cysts often develop as a result of another underlying problem in your knee joint. It's not just a random occurrence. Think of it like this. Your knee joint is like a well-oiled machine, and when something goes wrong, it can lead to fluid buildup, and you guessed it, a Baker's cyst. This fluid buildup is your body's response to inflammation or injury. Some common culprits include osteoarthritis, rheumatoid arthritis, meniscus tears, and even sports-related injuries. These conditions can cause significant wear and tear on your knee joint. These conditions can irritate the knee joint, causing it to produce excess fluid that eventually gets trapped in the popliteal space, forming a Baker's cyst. This trapped fluid creates the swelling and discomfort you feel. So if you're experiencing knee pain and swelling, it's essential to consult a healthcare professional to identify the underlying cause and get appropriate treatment. Sound familiar? Recognizing the telltale signs. So, how do you know if that nagging pain behind your knee is just a muscle strain or a Baker's cyst? It can be tricky to differentiate between the two, but understanding the symptoms can help. Well, there are a few telltale signs to look out for. Recognizing these signs early can make a significant difference in managing the condition effectively. The most common symptom is swelling behind the knee, which can sometimes be quite noticeable. This swelling can sometimes feel like a tight, rubbery ball, making it uncomfortable to move or even touch. You might also experience pain, stiffness, and a general sense of discomfort in the area. This stiffness can lead to limited movement in the affected knee, making everyday activities more challenging. These symptoms can be worse after physical activity such as running or even walking for extended periods. Or if you've been standing for long periods, the discomfort can intensify, making it hard to stay on your feet. In some cases, a Baker's cyst can even rupture, which can be quite alarming. When this happens, the fluid from the cyst can leak down into the calf, leading to sharp pain that can be quite severe. This can also cause redness and swelling in the calf, making it essential to seek medical attention promptly. Recognizing these signs early can help you manage the condition more effectively and prevent further complications. Getting to the bottom of it. How doctors diagnose Baker's cysts. Baker's cysts, also known as popliteal cysts, can cause discomfort and swelling behind the knee. Understanding how doctors diagnose this condition can help ease your worries. If you suspect you might have a Baker's cyst, don't panic. It's a common condition and can be managed effectively with the right approach. The first step is to schedule an appointment with your doctor. Early diagnosis can lead to better management and relief from symptoms. During your visit, they'll start by asking you about your symptoms, medical history, and any recent injuries you might have had. This information is crucial for understanding the context of your knee pain. Then they'll perform a physical exam, feeling around your knee joint to check for tenderness, swelling, and range of motion. This hands-on examination helps the doctor identify any abnormalities. To confirm the diagnosis, your doctor might recommend imaging tests like an ultrasound or an MRI. These tests are non-invasive and provide a clear picture of what's happening inside your knee. These tests provide detailed pictures of the inside of your knee, allowing your doctor to see the cyst, assess its size, and rule out any other potential causes of your pain. With this information, they can develop a treatment plan tailored to your specific needs, ensuring you get the best possible care. Relief is in sight. Treatment options for Baker's cysts. The good news is that most Baker's cysts don't require invasive treatment and often resolve on their own with a little TLC. Your doctor will recommend a treatment plan based on the severity of your symptoms and the underlying cause of the cyst. For mild cases, conservative treatments like rest, ice, compression, and elevation, also known as RICE, can help reduce swelling and discomfort. Your doctor might also suggest over-the-counter pain relievers or recommend physical therapy to strengthen the muscles around your knee and improve flexibility. Taking charge. Tips for prevention and management. While you can't always prevent a Baker's cyst, there are steps you can take to lower your risk and manage your symptoms effectively. One of the most important things is to address any underlying conditions that might be contributing to the cyst, such as arthritis or a meniscus tear. This might involve medications, physical therapy, or in some cases, surgery. Maintaining a healthy weight can also reduce stress on your knee joints. While regular exercise can strengthen the surrounding muscles and improve flexibility, if you have a Baker's cyst, low-impact activities like swimming, cycling, or walking are great options. Your knees, your health, seeking help when you need it. Remember, your knees are your friends and they deserve to be treated with care. If you're experiencing persistent knee pain or suspect you might have a Baker's cyst, don't hesitate to reach out to your doctor. Early diagnosis and treatment are key to preventing further complications and getting you back on your feet, feeling your best. A final word, moving forward with confidence. Dealing with a Baker's cyst can be frustrating, but it's important to remember that with the right information and support, you can manage your symptoms and live a full, active life. By understanding the causes, symptoms, and treatment options, you can take control of your knee health and move forward with confidence. And remember, I'm always here to help you navigate the world of arthritis and joint pain. Until next time, stay informed, stay active, and stay healthy.